Miklós, could you tell me what you think will be the greatest challenges for health and care systems?
To talk about the greatest challenges, we could sit here for days. But the things that are most important to me and the teams that we are working together are I think have critical importance. The human resources. I'm coming from a country from where more than 25% of the active medical population is working abroad. Many of them in the UK, and they are doing a nice job, so they are welcome here. But still, the consequential inequity and access issues and quality issues in the Hungarian healthcare are important. Just about 4 years ago, the average age of the publicly employed pathologists was 62 years. And the average age of publicly employed lab physicians or radiologists was 62 years. So I think if we cannot solve that problem, then we are in trouble. And we were saying this after the Belgian presidency back in 2011. We had the Hungarian presidency of the EU, and no strategic intervention could be achieved. And together this human resources challenge and that there was no strategic response on European level, these together add up one of the huge challenges. And then the skill set and the skill mix. And this digital transition that is coming, those 62-year average age diagnostic professionals, now they have to get used to not looking at the tissues or not looking at the images on the screen themselves. They went through these transitions from the film images to the screen images. But now they have to learn to teach the algorithms to do the diagnostics, and that will sort of not necessarily taking over the work they are doing, but helping them to do the routine work. So now there is this digital transition, and this is a very important challenge, whether the medical staff and the health staff and nursing staff is ready to do that. Are they willing to do that? And will they trust the machines? Will patients trust the machines? How do we do that transition? So human resources and the things that are assisting human resources and are in capability of responding to these challenges, that's together, it's really huge stuff.
Yeah, so two very big challenges there. And if you put yourself in the place of a health policy leader, how do you address those? Or how might you think about addressing them?
For 4 years I was one of them. And the number one thing is that the average life expectancy in that position where I spent a full electoral mandate is 20 months, or was 20 months in Hungary. And since then, it is the fourth successor after me in 4.5 years. So this policy cycle and the shortness of the policy cycle is a challenge in itself. So one thing is that we have to have a game system for change. So change and reform is a methodology. It's not just what to do, but how to do it and how to do it in a sustainable way. And you have to do it with agility. You have to do it with managing complexity for performance. So I think there has to be a game system for change that make our responsiveness to these challenges feasible.
And if you were thinking about how you might train future leaders to be able to think in that way and to have those sorts of skills, how might you go about that?
I'm coming from a region, Central Europe, where the magnitude and frequency of changes would be unimaginable for a British person. And we were really curious. Why did so many change efforts fail? And what we saw is that many of these change leaders, whether they were system-level policymakers or institutional or organizational managers, most of them were enthusiastic but inexperienced change agents. So they did not even know what they did not know. So they run into trouble, they committed mistakes, generated resistance, so the change or reform program collapsed, and then we restarted again. So my understanding is that we have to equip the next generation of change leaders or reformers with change experience and tools to manage and take complexity under control, and also give them process support, because that change experience does not come overnight. You have to start somewhere, and you have to collect the muscle and understanding and approaches for managing change. And you know, management in itself is a dynamic profession, because the always changing expectations. So this adaptational capacity of the managers and the change managers should be developed. So I would do this, and I would offer them process support.
Yeah. Wonderful. Thank you ever so much.
Thank you very much.